Day 10 in the Lindsay Clancy trial, we had Julie Pauls on the stand, and the Commonwealth questioned her. This is going to be a full recap for you. If you remember, Julie Pauls is the psychiatric nurse practitioner that Patrick's mother, so Lindsay's mother-in-law, recommended. So on November 20th, 2022, Dr. Paul remembers receiving a call from Lindsay's mother-in-law describing that she had gotten worse over the last couple of months since having her third child. When she actually had a phone call with Lindsay herself, she said that the symptoms became worse after the 12 weeks once Patrick went back to work after paternity leave. She then explained about the knowledge that she had of Lindsay's past medical history, that she had tried several medications, including Zoloft, Ativan, and Benadryl, and also mentioned Buspar. Now, she'd gone to the emergency room at that point on November 16th and then had been prescribed trazodone. So Dr. Paul said that Lindsay was worried about becoming dependent on medication. And so during the initial assessment, which she got assessed for a second time from Dr. Paul's, she didn't believe that Lindsay was at any risk, at least immediate risk. So Dr. Paul met with Lindsay in person November 21st. And during that initial plan, she said that Lindsay was very goal-oriented and that she was planning to return to work in October, but she delayed it until around November. So Lindsay did a lot of screenings with Dr. Paul, and she scored particularly high for generalized anxiety. And she described Lindsay as experiencing extreme anxiety, but that she tested negative for any self-harming at that time. Then she recommended that Lindsay go and do some talk therapy with Dr. Dukes, who she had recommended. So she scheduled that for December 2nd. Now, it seems like because she was referred by her mother-in-law that they actually had been texting on Dr. Paul's personal phone and that she was sending her updates every morning based on how she was sleeping and what medications she was trying to prescribe her. So at first, she attempted to find medications that she could tolerate. So she looked at her past history. And on December 25th, they discussed stopping the Prozac because Lindsay hadn't tolerated it and that she had only been taking it for about 3 days. So she basically cut cold turkey. And she prescribed a medication such as Klonopin as needed for anxiety and sleep, and that she had previously been prescribed Ambien. So on November 27th, Lindsay reported feeling disconnected and disoriented from some medications. So on November 28th, Lindsay experienced a panic attack, texted Dr. Paul, and that's when Dr. Paul recommended taking the Ativan right then and exercising. So going on a run, that kind of helps with adrenaline, she said. She also recommended a partial hospitalization program for Lindsay, but Lindsay told her that the program wouldn't work logistically for her at that point. So the following day, Lindsay met with another provider and reported taking Remeron. So she continued having sleep problems, and Paul's involvement with Lindsay ended shortly because Paul was leaving the clinic and moving out of state. I believe that the Remeron, by the way, came from a doctor in the same clinic as Dr. Paul because she was basically handing her off as a patient since Dr. Paul was no longer working there. Now, because Dr. Tuff's testimony prior to Dr. Paul's took about 6 hours, and I did a full recap. If you haven't listened, go back to my channel and you can see it, but they did not have time to do cross-examination. So tomorrow we're going to start the day off with Kevin Reddington, the defense attorney, questioning Dr. Paul. I'm curious to know your thoughts about Dr. Paul so far and Dr. Tuff's, just the entire day 10, because it was a lot. We got to decompress here.